Yeah?
Yeah, go.
Okay.
Go, Nico.
So when performing the manoeuvres in this video, it's important that we use standard precautions, gloves and goggles, and that we minimise any dangers to the patient or ourselves throughout the duration of the video. Okay, so now we're going to perform assisted positive pressure ventilation using the bag valve mask. First of all, it's important to make sure that the patient is in the sniffing position so that we have easy access to the airway. Next, we're going to make sure that the mask is the appropriate size for the patient. Simply do this by putting the mask over the patient's face, making sure that it covers his nose and mouth but doesn't exceed the chin, and we can get a decent seal from this. We'll now put it on the bag. We're going to ventilate this patient 12 to 16 breaths a minute, and it's important that we ventilate the patient 10 mils per kilo. We're going to assume this patient is 70 kilos, therefore we're going to ventilate the patient at a rate of 700 mils per breath. This bag is 2 litres, so we're going to breathe approximately a third of the bag for the patient, and like I said, 12 to 16 breaths a minute. When ventilating a patient, a common error is overventilating or underventilating a patient. Overventilation can lead to too much air in the lungs, and underventilation can lead to not enough air going around the body. Therefore, that's why it's important to accurately estimate the patient's weight and ventilate accordingly. Ready? Okay, so now we're going to demonstrate proper use of the laryngoscope. Before we start, it's important to make sure that the bulb is working and that it's stable on the laryngoscope and that it's an appropriate size for the patient. We also need to make sure that the patient is maintained in the sniffing position for easier access into the airway. First of all, we're going to insert the laryngoscope into the left side of the mouth and sweeping the tongue in one motion. We're going to pull up and have a look at the cords, making sure not to angulate the blade so as to pull on their teeth, as that is a common error and teeth can be ripped out and pulled. So instead of pulling backwards on the teeth, we need to make sure that we're pulling upwards on the tongue like so. Ready? Okay, so a common error with inserting an NPA is forgetting to apply lubricant, which means that it's too hard to try and put the NPA into the patient's nose, and therefore you're unable to get an NPA. Okay, so now I'm going to insert an OPA and oropharyngeal airway. It's important to make sure that the patient maintains the sniffing position while doing this to ensure easy access into the airway. First of all is to determine what size is appropriate to use for the patient. So we do this by measuring from the corner of the mouth to the corner of the mandible, just so. So this size is appropriate for the patient. When we insert it, we're going to insert it upside down by holding the flange at the top. We'll insert it halfway before rotating it 180 degrees and continuing to insert it until the flange is resting on the top of the lips. We must also make sure that the bottom lip is not being pinched between the teeth and the flange. Okay, so now I'm going to insert an NPA, a nasopharyngeal airway. First of all is to make sure that the patient is maintaining the sniffing position for easy access into the airway. Next we're going to measure what size we want, so it's appropriate for this patient. We're going to do this by measuring from the corner of the nose to the tip of the ear. Therefore we've decided that this one is appropriate for this patient. Next we can decide which nostril to insert it in, usually the larger one, so we're going to go with the left on this patient. Before insertion, it's important to put lubricant on it so that it goes in a little bit easier. And while we're putting it in, we're going to twist it ever so slightly just to help it go through a little bit. There we go. Once the airway is inserted into the patient, it should just be able to rest on the nostril like so. Okay. So a common error with inserting an OPA is if there is a gag reflex present. If there is a gag reflex, the presence of the gag increases intracranial pressure, which could possibly worsen a head injury. So if there's a gag reflex, we would not put it in. Okay, so now I'm going to insert an OPA and oropharyngeal airway. It's important to make sure that the patient maintains the sniffing position while doing this to ensure easy access into the airway. First of all is to determine what size is appropriate to use for the patient. So we do this by measuring from the corner of the mouth to the corner of the mandible, just so. so this size is appropriate for the patient. When we insert it, we're going to insert it upside down by holding the flange at the top. We'll insert it halfway before rotating it 180 degrees and continuing to insert it until the flange is resting on the top of the lips. We must also make sure that the bottom lip is not being pinched between the teeth and the flange. Okay, so the triple airway manoeuvre is different to the sniffing position as it involves the 3 manoeuvres, whereas the sniffing position is placing the patient as so he has an open airway. A common mistake used when performing the triple airway manoeuvre is not properly placing a pillow under the patient's head, which means that the airway could be compromised and then you wouldn't get adequate rise and fall of the chest. Another thing to remember is that for infants and toddlers, you might have to place the pillow under their shoulders because they have a bigger head, and then that way it would lead to being straight across. I didn't know how to finish that.
Go.
Okay, so now we're going to demonstrate the triple airway manoeuvre. The first thing we're going to do is a neck flexion. So we're going to do this by simply placing a pillow underneath the patient's head. This allows for the jaw to be in line with the chest and to open up the airway. Second thing we're going to do is tilt the head back by pushing the thumb on the forehead and the fingers on the occipital bones, and just stabilising the jaw with my other hand, pulling back on the head. This is the head extension. The final part of the triple airway manoeuvre is the jaw thrust. So we do this simply by placing our thumbs on the zygomatic arch of the patient and our fingers under the mandible, and this way we're able to protract the jaw forward whilst supporting and maintaining a stable position. This way we're able to have an open and clear airway, and we are able to look, listen and feel for breathing like so. Feeling for breathing, looking for breathing with the rise and fall of the chest, and listening at the patient's mouth.
Go.
Hello, my name is Lauren Schmidt. My student number is 24191485. The purpose of today's video is to demonstrate proper airway manoeuvres such as the lateral recovery position, triple airway manoeuvre, the insertion of an OPA and an NPA, the proper use of the laryngoscope and assisted positive pressure ventilation, as well as to discuss common errors associated with these manoeuvres and how to avoid them.